Selamat siang rekan-rekan semua, salam hangat, salam
Hello,
sehat.
good afternoon,
Terima kasih sudah
colleagues, comrades. Thank you very much for joining us in today's press conference on the condition of palm oil plantation workers during the COVID-19 pandemic. This event is held by TPOLS, which is a regional Southeast Asia network fighting for the rights of palm oil workers, laborers, women's group as well. My name is Rizal, the coordinator of TPOLS. And here I am only going to share briefly an introduction about this press conference. We are focusing on the tales from palm oil workers and their experience facing the pandemic in the past 1.5 years since the beginning of 2020. And this is a way for us to document and to report to public about the challenges faced by palm oil workers and their families. Later today, you will be hearing the stories about the transmission of COVID in their workplaces. They are already facing challenging work situations, and these conditions are worsened with the pandemic. The aspect that we would like to focus in specifically in today's press conference are three things: meeting the staple foods and staple requirements, the provision of health services, and also the right to organize. We have seen the increase of the COVID cases, especially because of the Delta variant. And we have seen a lot about these developments, but however, mostly we know about what's going on in Java Island. Meanwhile, palm oil plantations are mostly located in outside of Java Island, in Sumatra, Kalimantan, and then all the way to Papua. So we can see that gap between the infrastructure in Java Island compared to other areas. Therefore, you can understand the urgency of reminding everyone about the conditions that palm oil workers face outside of Java Island. Today, you will hear the vulnerability that the workers face from the transmission of the disease, as well as the impact of government policies in handling COVID. And these policies are not sensitive and oftentimes are not rightly targeted for plantations. So this is my short introduction. Again, to our participants, this event will be held mostly in Indonesia. We have simultaneous interpretation for you for English if you need so. You can also follow our press conference in T-Pulse's YouTube link, and we will share with you the link via chat. So now I would like to invite my colleague Ahmad Jaitulo from Sajokyo Institute to begin as the moderator for today's event. Thank you. Thank you very much, Rizal. Thank you. Good afternoon. Greetings to our colleagues from the workers, our colleagues from NGOs, journalists. My name is Ahmad Jaitulo. You can call me Ulo. I am from Sajokyo Institute. This is a research institute based in Bogor. Today, in this press conference, I will be your moderator. And before we begin, I would like to share the house rules or the code of conduct, so to speak. I will allow 5 minutes for our colleagues from the labor union, from labor unions, as well as other our colleagues advocating for migrant workers and others. And there are three main clusters discussed. First, we'll be listening to stories from the ground. These are the stories about the COVID pandemic that the workers face on the ground in the plantations. Next, we will hear about the stories from the palm oil workers because they're facing layered issues, multiple of issues. Specifically, for the second cluster, we'll be talking about the migrant workers in Sarawak, Indonesia. And third, we will hear about the condition of plantation workers from our colleagues from our network in Malaysia and the Philippines, how they're dealing with the pandemic. And then we will hear a reflection about COVID handling policies, about the policies to handle COVID and how this impacts our colleagues, whether these are palm oil workers or workers in other sectors. All right. So without further ado, I would like let's hear from our colleagues whose office is not very far from here. We'll hear first from Zidane. So we're going to hear the condition of the workers, of the palm oil workers, the general conditions that they face, especially during this pandemic. So without further ado, Bung Zidane, the floor is yours to share about what are the workers facing. 5 minutes, Zidane. Thank you very much, Mr. Moderator. Hello, my name is Zidane from Sawit Watch Indonesia. I am going to share just a general overview about what Indonesian palm oil workers are facing during the pandemic. During the pandemic, palm oil workers in Indonesia, they're not working as they would normally would. They still have to go to their harvest blocks, and they can't work from home. Maybe only their management can work from home. So during this pandemic, palm oil workers face challenges. They face difficulties in three main things: obtaining protection for health protection, protection for their employment, and getting staple foods and their staple needs. And they are facing a lot of vulnerabilities. In addition, we've learned information that there are temperature tests and swab or PCR test and also testing for the workers, but that's done after there are confirmed COVID cases. There are also cases where there's disinfectant spraying for their housing or working area. However, there are still morning briefings for the workers, and this creates a challenge for the workers where they will have to they have to work and get together, and workers have no option but to do the morning briefs. In addition, women workers, they have to go to their work sites in trucks, and these are very crowded trucks, and this puts them at risk of the COVID virus. And also, we have to understand that the conditions of palm oil plantations that are isolated in Indonesia, even though palm oil plantations are isolated, workers are still at risk of exposure. We've had cases of workers being exposed. On June, we've received information from workers in Kalimantan and Papua regarding the numbers of workers being exposed to the virus. So if we calculate, the number is more than 165 cases of COVID exposures. And of course, this is fewer than cases in cities. We are concerned that this is an underestimate of the actual numbers. We are concerned that this figure of cases in palm oil plantation, it's like an iceberg phenomenon where we are only noting the few cases because they are because of the testing. However, testing may not be available in the plantations. workers may not be able to access these tests, and that means they would have to travel to the district capital or even provincial capital to be able to get tested, and this is far and costly. And if they have to travel to the city to get healthcare, that means they won't get paid for that day because they won't be able to work. We've also received information that palm oil companies are not open about the number of confirmed cases in their plantations among workers. And this creates a huge concern for us because we don't know for sure how many cases there are, how many people have been exposed or infected by COVID. The government has paid very little attention to this. This is evident in the number of the available health services, the number of free testing, which is not available. In addition, the government, we've noticed that the government has not ensured that companies have adequate quarantine facilities. We've received information from workers in Kalimantan that the company's quarantine facilities are inadequate. In addition, regarding vaccination, of course, the numbers are very low. Some palm oil plantations have already given vaccines, whether these are done by the company or government. So in closing, as I've shared earlier, the production process continues in palm oil plantations. They are working as they did before the pandemic. Companies should be testing their workers, either the antigen test or the PCR test. Without they have to provide free testing and also PPE, personal protective equipment, to the workers. These are what the workers need. That's their complaints. They are having difficulties accessing these things. And if they have to buy their own PPEs, where do they have to go? The majority of the work in the plantations these are physical, strenuous work. Under current conditions, companies should reduce the work target or the work hours. On the other hand, in addition, companies also should provide vitamins or measures to improve the workers' immunity. Thank you very much, Mr. Moderator. Zidan, thank you very much. So I've noted three major points from your presentation. The first is about health protection. Companies, they do not provide health facilities for workers. Very minimum so far. Either it's in the form of the isolation space, space for isolation, vaccination or testing, or masks. And then there's also an issue of ensuring their employment, because during the pandemic, they still have to meet their target. The workers have to meet their targets. You've mentioned about the very vulnerable women workers, especially the women workers are daily casual workers. They are transported in trucks in very crowded trucks. Okay, thank you very much. Now we will delve into the actual conditions that what is happening in palm oil plantations, especially later. We will hear more. Today we'll hear more about the actual situations on the ground, especially with our colleagues in Central Kalimantan. So we will now hear from our colleague Anto from SAPASI, or the Indonesian Palm Oil Labor Union. So can you hear us? Yes. Yes. Thank you, Mr. Moderator. Bung Anto, the floor is yours. Thank you very much. Assalamualaikum, greetings and may peace be upon us. First of all, I would like to introduce myself. I am Dianto Arifin, representative from the Indonesian Palm Oil Labor Union or SEPASI from Central Kalimantan. I am also an active worker in a plantation here. Before I explain about the COVID-19 pandemic in the palm oil plantations in Central Kalimantan, first of all, I would like to share about COVID-19 in plantations. Hello? Hi, I'm losing you. Bung Anto, we can still hear you. All right. So workers comprise two classification. These are plantation workers and mill workers. And the mill workers are men and women workers, but the majority are men as opposed to women in the mills. Their work, in their work, the men mostly focus on production on the field. Meanwhile, the women are mostly the staff. They are mostly permanent workers. The second category are the plantation workers. These are men and women workers. However, there is no uh, difference between their quota, between their work. Some of them are casual daily workers. Some of them are contract workers. Now, if we are talking about the lives of workers in palm oil plantations, they work there. Well, at first they thought that COVID is only affecting, the belief was that at first people thought that that COVID only affected workers in cities, like manufacturing workers, factory workers. Meanwhile, palm oil workers they live remotely. Access into and out of plantations are also limited. However, in reality, that does not guarantee safety of the workers from COVID-19 exposure. Recently, one of the palm oil plantations in East Kota Waringin district, specifically in Central Kalimantan, dozens or even hundreds of workers, of the palm oil workers, these are harvesters, maintenance workers, supervisors, and staff, they were exposed to COVID-19. They were infected and they showed from severe to light symptoms. However, is their target reduced, their work target reduced? Are they getting better health services? Is it any easier to get their staple foods or their everyday needs? No. Companies are not changing the system of their work in such conditions. Health services are no better than it was before the pandemic either. Before the pandemic, company management creates new regulations to obtain rights for workers to be able to get health services in the plantations. Companies are making new regulations at the start of COVID. And then it's very difficult for workers to leave plantations because of difficulties of access. That is another factor to the, and also that causes them, that creates a greater need for them to get staple foods from outside of the plantations. The majority of workers can only look or shop for their staple needs from inside the plantation area. As we know, prices will increase and they will need more food, or they will have more needs. These conditions are also evident in the way the company management handles the situations. During isolation, there are some companies have determined areas or places for self-isolation. Some don't. So self-isolation can take place either in the workers' own homes or in other facilities. So if we look at the facilities provided by companies, these are still the bare minimum. These are inadequate. The facilities provided by the management is just minimum. And that's so the facilities that are provided are minimum, but some companies don't even provide these facilities. Workers live in very cramped living areas. So it is very possible for families uh, who are infected with COVID, it's very possible for them to expose other people, their neighbors, to COVID as well. Other facilities provided by the company, such as medicine and vitamins, we see that these are often late, they often arrive late, or uh, not enough, because companies should do routine checks with doctors, or they have to facilitate their workers by by supporting the workers to help them get get well faster, to get the workers better faster. However, we often find that workers in self-isolation, they are not getting enough food, or food and vitamins and medicine are late, or sometimes they don't even get them. And then the facilities provided from the medical team is just inadequate. There is one important point, in my opinion. The lack of understanding of workers about the COVID-19 virus. This is going to make it even harder to stop the spread of the virus. In some areas, like in where I work, the local district and provincial agency has appointed or worked with the company's health and safety division. However, they only come or if there are cases, or the local government agencies only disseminate information to the company health and safety department. So instead of going directly to the plantation, so that creates a negative stigma amongst the workers. They thought that it has led workers to some of them not believing that there's COVID. Some think that, no, it's nothing major. But what's worse is that many workers avoid getting tested. They hide instead of getting tested. And it seems that they do not care about that because there's not enough socialization or information dissemination. They have limited understanding. And um, this is one of the major challenges that we see among palm oil workers. Halo, Bang Diante. You don't have much time left? Okay, I just want to say that we, from the local government, specifically the COVID task force, and the local government, to be able to disseminate information to palm oil workers about COVID-19. And so disseminate information to workers, not through the health and safety from the company. And then about vaccination. vaccination for all palm oil workers in East Kotawaringin district. And then, in addition, I asked the company, all companies in East Kotawaringin district, to be able to engage workers' representatives, namely the labor union, to formulate new SOPs to prevent and manage self-isolation, and also for monitoring the social distancing or the public activity restrictions. I also, we demand that workers can get their rights uh, if they are sick, and also immediately share the follow-up of the testing done by companies and share that information to the hospital to make sure that workers get the best health facilities. Thank you very much. That is what I can share with you from East Kota Waringin in Central Kalimantan.
Cukup panjang dan
Thank you.
It's quite elaborate, and I think there are some points that I take notes on. You say that even though the labor settlement mills and plantation, even though they are living in remote areas, but they are still having a risk of exposed by the COVID. And it has been proven that there are many laborers getting COVID-19. And then another point is the social restrictions inside the plantation is impacted the rise of the staple food. The staple food price is increasing due to the social restrictions. And you also mentioned that many workers did not aware about the they don't have enough understanding about COVID-19. So you said that you also hope that there's going to be vaccination for workers, and you hope that there's a clear SOP for self-isolations procedure. Thank you, Anto, for sharing with us. And now we are going to hear from the same island in East Kalimantan. We are going to hear the story on the health and health facility and access to food. And the situation at this moment will probably, it's poor, yeah? So I would like to invite Mr. Cornelis from SPN, or National Labor Union, to share his story. You have 5 minutes. Thank you very much. My name is Cornelis Williawan Gatu from National Labor Union, East Kalimantan. Before I share with you, I'm going to update the conditions of the workers in regards to COVID-19. In the oil palm sectors, we have received reports from West Kutai, East Kutai, Pasir district, and some several area in Kutai Kartanegara. We have workers infected by COVID-19. In West Kutai, in one plantation, there are 30 people infected by COVID-19. And in East Kutai, we receive one of the plantation has 15 people positive COVID-19, and in other several plantations, also we receive the similar news that we are now confirming the numbers. So the workers exposed to COVID-19, infected by COVID-19, they are undergoing self-isolation. However, these workers did not receive adequate health service. Another problem for the workers who undergo the self-isolation, they did not receive any salary or compensations, even though we know that this condition is extraordinary. These workers who undergo self-isolation, they did not any vitamins or any health service. And also the impact of COVID-19 to the workers in the plantation sectors is the loss of access to food and the increased price of food. Where is the government's role in this? Government did not give a serious response, and they did not show concrete actions to handling what happens in the plantation workers. In East Kalimantan, as a representative of the workers here, I just want to say that the government should pay attention to us, not only receiving the benefit from the workers. What I want is that the government to have a cheap market program for the workers here, and we want the government to have programs for workers here to help the condition here. And because of many workers being infected, the companies limited the access to the plantations, and it also impacted to the access to food. It's hard to get food here. And there's also another threat, the freedom of associations, because a company already restrict the access to the plantations. And the workers, if they need to travel outside the plantation, they need to do a PCR test. Well, in East Kalimantan, a PCR test will cost 900,000 rupiah. If you want a fast result, it's cost more than 1 million. And of course, the workers cannot afford this test. In Sumatra, in London, Sumatra, they limit the time of work, and for workers who ages over 70, the company asks them to keep working. There are a lot of things that make the workers' conditions very bad here. Actually, there's a lot of things, but that is all that I want to share at this moment. Thank you very much. Thank you, Mr. Cornelis. Yeah, I take notes on something, especially the COVID-19 situations. You say that there are 30 people infected in West Kutai, 15 people in East Kutai, and there's also an issue of freedom of associations in East Kalimantan. So the company says they're going to limit the travel of the workers, and it makes it your work harder. And of course, it's also a threat to the freedom of associations. And you also mentioned the crisis of food, especially the rise of the price of the staple food. And you also mentioned the lack of health services by the government or the company. So you mentioned that it's as if the government neglect the workers there. We are still going to hear more stories surrounding the plantations from our other speakers. Thank you, Mr. Cornelis, for the sharing. Now we are going to go from Kalimantan, we will go to Sumatra. We have here Mr. Supono from Indonesian Plantation Trade Union. We're going to hear what happens there. Is it similar to what happens in Kalimantan during the COVID-19 during the COVID-19 pandemic, or do we hear anything different? Mr. Supono, are you here yet? Hello, Assalamualaikum. Hi, Mr. Supono. Thank you. Thank you for being here. Yeah, I want to hear from you what happened in Sumatra. And we want to also hear the impact of the COVID-19 and how you handle COVID-19 in the plantation in your place. The time is yours. Thank you. Assalamualaikum. May peace be upon us. Thank you very much. Before I begin my story regarding the conditions in North Sumatra, please allow me to introduce myself. My name is Supono from Indonesian Plantation Trade Union. I'm from Medan, North Sumatra. If I'm going to talk about plantations, of course, I have to talk about what happens in North Sumatra because the history of plantation in Indonesia starts from North Sumatra since the colonialism era or since the plantations, oil palm plantations started in Indonesia. The violence against workers and other treatments we in North Sumatra experienced that first because the owner of the companies and the plantations issue of freedom of associations, gender, PPE, etc. Regarding COVID-19 handling in North Sumatra, especially in the plantation sectors, for vaccination process, it happens mostly it happened mostly through the government's program. However, there are some companies who also had a vaccination program for their workers. However, during the vaccination process, the workers still has to work. They are working shifts. So after they getting their shot, they have to go back to their post. Of course, it's difficult for the workers because, as we know, for one plantations, usually it consists of 3,000 hectares. You can imagine if the vaccinations only happens in one point, in the plantations, they have to travel so far. So the work condition there, they have no day off. They cannot work from home because they are harvested. They have to go to the field. They have to work every day. They don't have any day off. In one company, we noted that the target is so high. They have a very high target. For example, the target in one position is a 57 fruit bench. In 95, the normal target is 40, but the workers have to reach the target of 60 fruit bench. And they also has additional work. They need to prune the fronds, 60 trees per week. If they do not do this additional work, they're sanctioned for them. Some of the workers receive a warning letter because they did not reach the target to prune 60 trees per week. In other side, due to the travel restriction, of course, they cannot in and out the plantation freely. And the people from outside, they cannot also visit the plantations freely. And it impacts the supply of food in the plantations. For the plantations near a large city, it's easier for them to get access to the food. But for the plantation that is located in the remote areas, it makes them difficult to get food, because in order to get food, they need to travel outside the plantation. They have to ask for permissions. In the normal condition, usually the sellers come to the plantations, but due to the restrictions, they are not allowed to do that. So for plantations in the remote areas, they're really having difficulties in accessing the food. Regarding vaccination, the information that we receive from the ground, 2 days ago, the vaccination program starts to roll out. However, is not facilitated by the government. Sorry, it's not facilitated by the company, but it's facilitated by the government in the sub-district level or in the district level, or even the vaccination program is held in the police station. In regards to the work equipment, we receive information that it's also hard to get equipment during pandemic. Before pandemic, if the equipment is, let's say it's broken, it's easier for them to get replacement. But at this moment, if their equipment, let's say their stick is broken, they cannot get replacement. They can only get it fixed. As for the mask and hand sanitizer, from the information that we get, the company did not provide mask and hand sanitizer to the workers, but it provided by the local government. So the company did not provide masks to the workers. Regarding the information of the workers affected by COVID-19 or getting infected by COVID-19, we do not have the numbers yet. However, we do get information that not only the workers, even the community surrounding the plantations, they have this worriness that even if they got like fever or cough, they afraid to go or to report themselves because they are afraid that the doctor will tell them that they get COVID. So they are afraid that if they go to the hospital, the doctors that will say, "Oh, you got COVID," and it makes the situations difficult because they do not want to be labeled as positive COVID because it will make them it will make them hard to go outside the area. Mr. Supono, your time is up. Yeah, just a few more minutes. So they are afraid that if they're being told that they got COVID, they're afraid that when they die, they cannot be buried in their homeland, but they have to be buried in their workplace. So they do not want that. Regarding the negotiations from with the agency, we have started negotiations with the workforce agency, but due to the COVID-19 pandemic, we have difficulties to following this up to the industrial agency or the industrial ministry. So yeah, so that's what happens in my place. I hope that we can elaborate more in the discussion. Thank you very much. Thank you, Mr. Supono. It's quite lengthy. Yeah, there are some points that I take note on. It's a bit different with what happens in Kalimantan, especially in vaccination programs. You say that in several plantations, there are vaccination programs from the government and the company, yeah? And you do not know how much workers has infected. However, even though there's initiative in vaccination program, the workload is not different with the other areas. You mentioned that the work hours is increased even, and there's a new rules that the workers has the target of pruning 60 trees per week. And if the workers did not achieve that target, they will receive a sanctions. So high work hours and high target. You also mentioned about the about the health facility that provided by the local government, but not from the company. And you also remember, you also explain about the negotiation process with the agency. Thank you very much, Mr. Supono from the Indonesian Plantation Trade Unions. Now I'm going to go to our next speaker, Mr. Robiansi from the Prosperous Oil Palm Trade Union, or SBSS. However, I just being told that Mr. Robiansi cannot join in this meeting, but I got a message that the COVID-19 situations in PT Agropatilama, this is his message. Robbie says that during the pandemic 19, PT Agro Patilama in Musilawas, South Sumatra, never conducting tests. They never provide masks to the workers. They do not have vaccination program as well. And the workers also did not receive any vitamins. And there's no changes in the work hours. It's still the same with before the pandemic.
Situasinya hampir sama lah ya dengan yang terjadi di Sumatera Utara. Cuma ini kayaknya memang lebih
So it's the condition is actually similar with the North Sumatra, but it's maybe worse because they don't have any vaccination program and they do not get any health facilities such as masks. Okay, now
klaster lain ya. Tadi adalah kita mendengar cerita lapangan yang begitu banyak dari teman-teman
now we are going to hear from other speakers from the oil palm labor in outside the country. Sorry. So we're going to hear from outside of Indonesia. The situation there is more complicated because they are a migrant worker. They're not just coming from different province or different district, but they are coming from different countries. They are migrant workers. And we have here colleagues that is being doing advocacy, and they're going to share the situations of the Indonesian migrant workers in Sarawak, especially during the COVID-19 pandemic. So I'm going to invite Firman from ABKS, or the Alliance of West Kalimantan Palm Oil Label. Firman, are you here yet? Yes, we're going to hear about the migrant workers in Indonesia. We hear about the death of the migrant workers in the plantations during the COVID-19 pandemic. Can you share more about that?
Thank you very much. Thank you very much, Bung Ulo. Good afternoon. My name is Firman Junmanto from the West Kalimantan Labor Alliance. One of the advocacy work that we've done recently and currently working on is advocacy for two migrant workers, spouses. The wife has passed away several months ago because of COVID. Mr. Seyfried and his wife, they were palm oil workers from East Nusa Tenggara. They worked in Sarawak, Malaysia
for the largest palm oil company there. Mr. Seyfried, he is a fruit loader. He worked with the trucks carrying the fruit bunches, and his late wife worked to collect the fruit bunches. On May 2021, she began working as to apply fertilizers in the company. Previously, she was tested and she was deemed healthy by the company doctors. That is why the late wife was able to work sick. Her head was hurting, and then she was unable to get up from her bed. But Seyfried reported her case to the foreman. After 2 days feeling sick, Miss Matanin was checked by the doctor in the plantation, and they only gave her just the bare minimum medicine. On the 17th of May of this year, the daily workers manager in the plantation told Seyfried to bring his wife home to Indonesia to get medical care there in Indonesia. So he borrowed money from his relatives who were also workers in the plantation. The two of them traveled to Indonesia by land, and then got to Antikong. When they got to Antikong, there were no medical checkups, and they did not receive any documents because Mrs. Matanin's condition at that time, she had to be taken to the hospital urgently. However, there were no solutions provided, and no one provided assistance to get her to the hospital. So the two rented a taxi from Sangao district to the hospital in Pontianak City to get medical checkup and health checkup for Ms. Martanin. When they arrived to the hospital, she was tested, and she is COVID positive. In addition, the doctor's examination found that she had stroke. She was showing symptoms of stroke. She had to be isolated in the hospital for 14 days. There were no additional information about her health, about her condition. Her husband received no information or updates. After the hospital said that because there's no further information, Seyfried was told to self-isolate. But because he had nowhere to go, the two of them were placed in a government provided facility for self-isolation. This is a government facility. They self-isolated in the public housing area from the government for 14 days. And then Mrs. Martanin was tested, and she was tested negative by then. We tried to get them back to their hometown. However, instead, they were taken to the West Kalimantan social agency to live there. After 3 days of staying in that facility, the next morning, Bu Martanin passed away. She died, and she was buried in Pontianak following COVID procedures, because the justification was that because she previously had COVID. We are currently trying to get Mr. Seyfried back home with assistance from our network. as well as we are also working with our network and East Nusa Tenggara uh, Association in Kalimantan. That is the update of the case that we are working on. Thank you very much, Ula.
Saya kira ini jadi kasus yang perlu
Thank you
kita
very
cermati
much.
bersama ya.
This is a case that we have to focus on together because this is ongoing.
Dan
Yes, that is correct.
itu
It's
bisa
ongoing.
kalau beberapa kali Tipol
So
dan jaringan
TPOLS and its network has shared a number of press release on migrant workers, on Indonesian migrant workers. We've done studies,
paling banyak adalah
and
di wilayah Sarawak.
the majority are workers in Sarawak.
Banyak sekali memang
There
yang ilegal.
are many illegal procedures taking place.
Situasi COVID
However,
ini menjadi satu
however, COVID has added another layer of problems, and it is becoming more. It's creating an even more difficult situation for migrant workers.
karena alasan COVID ini
Because of COVID,
sampai sekarang
to this day,
Martangin
the body of Miss Martangin
Barat ya
is already buried in West Kalimantan, right?
nggak bisa di
Yes, in Pontianak.
halaman sementara Pak
So her body could not be buried in her hometown in East Nusa Tenggara, right? Yes. And her husband is Mantan also, and we contacted the National Agency for the Placement and Protection of Overseas Workers, and we are still not we are still lacking some documents to get him home. Thank you very much, Pung Firmansyah. Thank you very much. Now we will hear about the conditions of migrant workers in Indonesia, specifically about those who are still facilitating migrant workers, and the majority are working in Malaysia, in palm oil plantations in Indonesia. We want to hear from Suryani from the Sovereign Migrant Workers Coalition. Are you with us, Kak Suryani? Thank you very much. We'd like to hear from you about the situation. What is happening today, especially during this pandemic? We want to hear your story specifically about the flow of migrant workers traveling in and out of the borders and deportation. And we know the cases of deportation is still quite high. So, Mbak Suryani, the floor is yours. Thank you very much, Ulo. Good afternoon, everyone. Our colleagues from the networks, from journalists. My name is Suryani from the Sovereign Migrant Workers Coalition. The pandemic has created or made all layers of our lives is because the pandemic has caused so much more problems, added extra layers of problems to all aspects of our lives. For the past 1.5 years, based on our observations, we have not found any candidate migrant workers to leave the country, specifically to Sabah or to Malaysia. That is our observation from KBMB. This happened after the agreement by the governments of Indonesia and Malaysia to have stricter border border restrictions between Indonesia and Malaysia. This went into effect on April 2020. With these restrictions, the closing of the borders, that applies for those leaving the country. However, what's happening is that there are many repatriations of migrant workers from Sabah, Malaysia to Indonesia. KBMB has noted 1,082 people being deported from Sabah during this pandemic to Indonesia. This is during the pandemic. Before they returned to Indonesia, this 1,082 people, they had to go through quite lengthy process there. They were arrested or detained. Some were placed in the detention centers, temporary migration centers. They're facing diverse situations. Many shared with us their stories and their conditions in these temporary migration detention centers. They had to sleep in crowded areas. The facilities were over capacity, or they had to sleep on their sides because the detention centers were so crowded. They only could get running water at 3 a.m., so they would have to get up at 3 o'clock in the morning to shower. Similarly, with drinking water. Other facilities, such as health services, were not provided. For example, some had rashes, and the elders, they were elders and children. If they were sick, they did not get any treatment, any medical treatment in these facilities. And also for pregnant women. One of the cases that we encountered, there was a pregnant woman, and she was not taken to the hospital. Instead, she was taken to the hospital after her water broke. And her water broke, but the baby was not born yet at that time. These are some of the cases. In addition, there were cases of the use of force in these facilities. For example, child exploitation, where children were made to work in these facilities. In addition, some were beaten, and this was justified as punishment from the detention center officers. The food provided were also inadequate. They received raw ingredients, just uncooked food. The food or the food was cooked in sand, so there was still sand in their food. And many of these people were traumatized. Our coalition interviewed a number of workers, a number of they said, we are treated as arrived in Indonesia. They're facing similar issue. These hardships continue. They're still facing these challenges in Indonesia. They get to the facilities in Indonesia, and they're still facing these challenges. The elders, children, women who are nursing. There are no places or areas for children. Some had to stay in these temporary facilities for 3 months, 6 months. It's very concerning. It's even for myself, it's very difficult for me when they share about the situations that they're facing. When they arrive to their villages, to their hometowns, especially the women who were deported, they face double the problem because there is a certain stigma. In addition to COVID, they are seen as spreading the virus because they came from overseas during the pandemic, and there's some people think that these are not good women. so they must have made some, they must have done something wrong to be deported. Therefore, they're facing even more trauma once they get back to their hometowns. These are some of the challenges that we have found in the women workers in Pinrang and Bulukumba districts in South Sulawesi. So these are just some of my updates, and I hope that we can have further discussion about this. And in addition, based on our investigation for the past year, I hope that we can share, I hope that the organizers can share our investigation results for the others to read. Thank you very much, Kak Suryani. That's an important point because not many people are aware of migrant workers' conditions, specifically during the COVID-19 pandemic. So KBMB and its network has issued a report, has published some data. But as we've heard from Suryani, with the current pandemic, she said that there are 1,082 migrant workers deported recently. Yes, that was during the pandemic. They are deported. So being deported does not resolve their problems. Instead, they face additional layers of problems, starting from the temporary migration detention center with inhumane treatments, inhumane facilities. You said there are dozens or even hundreds of people being piled up, cramped in these facilities without water, inadequate food as well. That's an issue. And when they are returned to Indonesia, to Nunukan in Indonesia, when they arrive to Indonesia, they're facing other problems. The facilities are inadequate for these people, for elders, for children. And that makes them extra vulnerable, especially with COVID. In addition, when they get home to their hometowns, there is that stigma that the migrant workers face as people who are spreading COVID, and women and the women workers are seen as troublemakers. They got into trouble abroad. That's why they were sent back home. These cases require our joint attention to rectify. Suryani, thank you very much for your information, for your very comprehensive and very touching story. Now, let's hear from Emmy from JPIT, the Eastern Indonesia Women's Network. Are you there with us? Hi, I'm sorry I'm a bit late because I just gotten from the field side. Can you hear me? Yes, we can do. Miss Emmy. Are helping the repatriation of bodies of workers, repatriation of bodies of workers from their workplaces, from abroad to get to their hometowns. Can you tell us about the work process, about your work and the process? However, we apologize because we have limited time. Each of our participants have 5 minutes. Will that be enough for you to share your situation now? Yeah, sure. The floor is yours, ma'am. Hello, my name is Emmy. I focus on the human trafficking network. I I I am a priest in one of the churches here. We focus on humanity issues and human trafficking issues in East Nusa Tenggara. We work with the Eastern Indonesian Women's Network. They call me, here I see Ibu Maria. We are the cargo people. That's what we are called. And there's also the we work with others. We work in cargo. We work with our brothers and sisters, migrant workers who people say are non-procedural when they leave the country and they return just only their bodies when they return. As of June, we have helped repatriated 81 bodies, 99.9%. Only one person was had official documents, but that was because of accidents. We work with Gamit. We have a shelter to help not only shelter but to transform and reintegrate these victims. Our shelter compiled an end of the year report about the problems with the services provided in cargo. The majority of the repatriated bodies, the majority are sick because of their or overburdened with their work. The majority are palm oil workers. These are hard laborers. They do strenuous work, and the majority are non-procedural workers. So does that clarify as human trafficking? We work together with the police, and they test the cases whether it is a human trafficking or not. But when we interview families, we know that they were overworking, they were overworked. So they're overburdened in their work, or they do several types of works in the plantation. So there's no social insurance scheme because they're non-procedural workers. They are terrified to go to hospitals because they're worried that they're going to get arrested. They get sick because of the hard work that they do. We see cases like heart failures, lung failures. So out of that 81 bodies, 74 were palm oil workers. So if we're talking about non-procedural workers and human trafficking in East Nusa Tenggara, this is closely linked to palm oil plantations in the destination countries. The majority are Malaysia. The majority of the workers come from remote areas in Flores, in South Central Eastern District, Timur Tengah, Selatan, and these are urgent. The cases are urgent. The condition is urgent. The number of deceased accumulates, but almost every day we get bodies. So this shows an extraordinary case. I mean, if we get several in a year, okay, we can understand that. And the majority of the deceased are of productive age, from 20 to 40 years. There are cases of people who are older, but that is because when they migrated, it was what we called cultural migration. In Flores, we know that many people have left to go to Malaysia to be cultural workers, and they live there for generations. I've also heard from the earlier speaker about the deported workers in detention centers. So we got cases of that. So these are quote unquote the cultural migrants. They've stayed there and the children, their grandchildren of these cultural migrants they don't have the document, so they're non-procedural. But they were born there, or maybe they were very young when they moved to Malaysia, so they didn't really know what is their hometown, even though they're originally from East Nusa Tenggara. These are just some of the stories about the repatriation of bodies. The majority of workers who left because of these non-procedural, who are non-procedural, they had to leave and be migrant workers because they had no option because of poverty, but actually because there's no more land for them. And uh, and I was asked to share information with colleagues doing research, which I will do in the future. But the majority of these people, they come from families who only get about 50 to 100,000 rupiah per month. So it's very difficult for them to make livelihood. And the village economy here, the condition is still poor compared to the conditions in Java Island. And the land here is very dry. Each family, they don't have adequate land to produce something from their land, to have productive land. They only have enough to eat, and that's why many of them have to travel abroad, overseas, to work. Sometimes it could be their friends, their relatives who invite them to work like this. And when they leave Indonesia, these are mostly non-procedural workers. And many workers leave non-procedural ways during COVID. So that brings us the question, who are they're trying to provide for themselves? So we see that there are certain uh, people with some backing that can get these workers across the border during these times. Again, the majority are palm oil workers, laborers in the informal sector. The law, especially with the latest job creation law or omnibus law, it's going to make it more difficult for them to travel abroad following the procedures. So these are some of our experience working with the repatriation of bodies, with the churches, and we work with our colleagues abroad. We also work together with Ibu Maria um, and the Indonesia Migrant Workers Protection Agency, because we want the workers to their bodies to be returned to Indonesia with dignity. In our province, we are facing a number of challenges like the Seroja a natural disaster and COVID. So it has taken a lot of our energy, and there is mafia operating there. After the natural disaster, there are some mafia operating and to get these workers abroad. They were taken abroad, and our network and the church were able to catch these cases. Now we have to focus on the workers who have been deported, who are stuck in the detention centers, as we've heard from the previous speakers. So thank you very much. I hope that can trigger further discussions.
Terima kasih Ibu.
Thank you very much. It's a very important information for all of us because T-Pulse is a network. It's not only in Indonesia, but also in other areas in Malaysia as well. Yeah, I see Mr. Pereira. I met with him in Thailand. Yeah, I wanted to ask 81 dead bodies. Can you tell me the time range from January to June 2021.
Saya kira yang jadi ini juga jadi penasaran.
Okay. Yeah, what made me also curious, and maybe Maria can add to that, during the pandemic, it seems that there's an increase in illegal migrations to Malaysia. And I think Ibu Maria can tell more about this. There are so many information from Ibu Amy, but this could be our preliminary information. But I want to also hear from Ibu Maria. So Ibu Maria has been work in migrant workers issue. Yeah, she's also a survivor. Yes, so she's many of the migrant workers in Malaysian plantations comes from Ibu Maria's village.
Selamat siang.
Yeah, good afternoon. My name is Maria Hinggi. I'm from Indonesian Migrant Workers Union. Thank you for this opportunity so I can tell my story. Stories about the conditions during the pandemic. During the pandemic, there's still recruitment happens of workers in East Nusa Tenggara. Recruitment during pandemic that I found is in last May. So last May, I found a recruitment. I went to the villages in Campong Dua in Kupang district. So we facilitate this village. We have a program here. They have a village regulations of the PPO. I met with one of the formers of migrant workers. They told me that just recently they got offered to go to Malaysia, but they refused because they say that it's impossible to travel anywhere during the pandemic. The borders were closed. And they say to me that in borders and in transit places, there are offices. Offices are looking out for any migrant workers. But he told me that there are 10 people from Middle East District, Timur Tengah Selatan. And he also told me that there were some officers from the company visiting in the village and to pick up some people to go abroad. And I was then thinking, oh, maybe they are working to Kalimantan because they don't need papers to go work to Kalimantan. And maybe once they arrive in Kalimantan, they will go to Malaysia through the border stairs. We don't know the conditions there. Are they going to receive protections? Are the work condition there? And just recently, I also received information in my group that there are 2 migrant workers passed away due to COVID-19. One in Kupang district, Laurentina de Jesus Barbosa, and the second is from Ende, Cornelia Buko, from Ende district. So these 2 women passed away due to COVID-19. Miss Florentina the family wants the corpse to be buried in the hometown. They are still waiting for the agreement letter that their daughter will be buried there. Because for COVID cases, the understanding is that the corpse will be buried in that place. Just recently, Ibu Marta, as we heard earlier, also passed away, and I also shared this news that we cannot repatriate the bodies to be buried in the hometown. So after I give understanding to the family then agree, okay, the body can be buried in Malaysia. There's another sad news. I know a migrant worker who works for 4 years. Her name is Tidomisa. She works for 4 years and then passed away, not because of COVID. But then when the family asked for the repatriation of the bodies, the cost is very high. It's 8,500 ringgit. And the employer says that they can only cover 3,000 ringgit, while the remaining 5,500 ringgit, the family asked the Embassy of Indonesia to cover the cost, but then the embassy says that they cannot, or they do not have a budget for that.
Dan mengenai itu yang apa yang Ibu Pendeta ini sampaikan, memang kami sering menjemput jenazah di kargo dan juga
sorry, there were other speaker.
Maaf Bu Maria. Maaf Bu Maria.
Berjaga.
Sebentar dulu, kayaknya ada masalah.
Excuse me, Ibu Maria. Yeah, so I asked for the manpower agency in East Nusa Tenggara about the deportation case, and they say that the repatriation of the workers is not only from Batam, but also from Sulawesi. So there are several ways to repatriate the workers. And there's also the case of interracial marriage. They are not only married with Indonesian people there, but they also married with, let's say, people from the Philippines. So when they want to go back to their hometown, they are confused, the children there, because the children from the interracial marriage are confused because they don't know where they belong to. Okay, thank you, Ibu Maria.
Kesalahan teknis. Kayaknya ini ada yang kurang berkenan di forum ini. Terima kasih banyak Bu Maria.
Okay, sorry. It seems that we have intruder in this Zoom meeting. Yeah, anyway, thank you, Ibu Malia. Thank you for sharing the story of the Indonesian migrant workers. There are, you say that there are 2 workers passed away due to COVID-19, Florentina de Jesus and Cornelia.
Terbaru data atau informasi yang bisa diterima adalah seperti itu. Saya kira dari cerita Bu Maria, dari cerita
So from from the stories that we hear from Maria, Firman, we know that when a migrant worker pass away, it's very hard for the reputations of the bodies. You also mentioned about the long process, and it just getting worse due to COVID-19 pandemic. In the health service or the health centers, of course, they have procedures and protocols, such as the case of Ibu Marta Angin. She has to be buried in Malaysia and cannot sent back to the hometown. Sorry, so for Florentina, they have been buried in Malaysia. Oh yeah, sorry. And I also take note on the situation of the migrant workers. They are in a very risky situations, and we need to pay attention to this. Not only migrant workers from Indonesia, but I think other networks, international networks, they also need to pay more attention to the migrant workers case. Ibu Malia, thank you very much for sharing the stories. Thank you, Ibu Emi and Mr. Firman. And now we are going to hear stories from our networks from the Philippines. Yeah, for your information, the speakers from the Philippines will speak in English. So if you need translations, if you need the interpretation in Bahasa Indonesia, please click the interpretation menu, the globe icon, and choose the Bahasa Indonesia option.
Hello, good afternoon. My name is G. Estrada, and I represent the disease expansion of agribusiness plantations in the Philippines. I'm also with the Federation of Agricultural Workers. I'll just brief. And I also would like to explain that I will also say about not only about palm oil workers, but agricultural workers in general in the Philippines, especially sugarcane workers, because they are the most number in the country, around 700,000 only in the field. In the Philippines, our government is very inefficient and ineffective in controlling the COVID and in helping the people. What they do, like right now, they always impose lockdowns, like meaning putting up checkpoints or using a militarist approach. And it was worse last year, and hopefully this year it would not worsen, especially due to the various variants of COVID-19 which are appearing. But last year, three sugar mills stopped operations because some of the workers had COVID-19. And because of that, many of the sugar workers, the agricultural workers, were not able to go to work, of course. Other than that, the police and military were very strict in checkpoints, even if the Department of Agriculture said that farmers and agricultural workers should not be hampered in their production, but they are stopped from going to sugarcane fields from one field to another. No? So many of them were not had no job during the pandemic, and not all were given assistance by the government, because the government is saying that it will provide monetary and food assistance to those who are not allowed to go out of their houses, or if they are affected by the economically by the pandemic because of all the restrictions. No? For example, there are 9.7 million Filipinos working as farmers, agricultural workers, and fisherfolk. No? But not all receive assistance from the government. No? For sugar workers in the biggest place where sugar workers are, Negros, only 70% got monetary assistance. But in northern Philippines, it's less because of many conditions. No? One example is they only give per household, even if there are 2 or 3 families in one household, or if the agricultural workers are staying there temporarily, like rent a room. And the one government agency under the Department of Labor and Employment only gave out 49 million pesos to 49,000 sugar workers and farmers, considering that there are 700,000 sugar workers in the field alone. No? This does not include the small farmers and the mill workers. No? And the Philippine government's national and local health response to the pandemic is severely lacking. No? Up to now, we only have 50,000 RT-PCR tests, when we need 3 times more of that amount to be able to determine how many Filipinos are really sick with the disease. No? And the Philippine government is using the pandemic situation to exact more repressive rules and subject workers, farmers, agricultural workers to red tagging, meaning they will tag you as a rebel, as a communist rebel, harassment, and other human rights abuses. No? And even the passage implementation of the anti-terrorism law was made into law during the COVID crisis. No? For example, in Negros Island, where the majority are sugar workers, 5,000 have been red tagged as rebels. And lately, even in Isabela, in northern Philippines, UMA, because the name of our chapter is UMA Isabela, the same name as the national organization. They have also been red tagged, and while in Mindanao, in Dole, Philippines, which produces pineapple, 478 regular workers were retrenched late last year because it was the time of certification elections, meaning there should be elections for new union. No? And the military, security guards, and the police were used to intimidate the workers. Fortunately, because we have a strong organization there, at least 1/3 of the workers were able to come back to work. And that. What else? For palm oil, the price is very low, because I read the position paper of Peoples that the price increased supposedly, but in the Philippines, specifically in Bohol province, in the middle part of the Philippines, 1 kilo of palm oil fruit bunch is only 3 US cents per kilo. No? So they do not bother to harvest it anymore. No? Just burn it for fuel. No? And so there's a very big problem of aid, and the human rights violations are continuing, and people are getting sick. No? Maybe at present we are not as our situation of people getting sick is not as grave as in Indonesia, and hopefully it stays that way. No? But we promise to continue in asserting the rights and welfare of agricultural workers, including palm oil workers. No? And recently, we also already filed a formal complaint. No? Our organization and the National Federation of Sugar Workers has already filed a formal complaint to the International Labour Organization on the many killings of workers. No? Because of the 50 workers in the whole Philippines killed, extrajudicial killed by the Duterte government, 27 are agricultural workers, and 16 of these are from one organization, the National Federation of Sugar Workers. No? And some organizers of in palm oil work, especially in Mindanao, where there are most palm oil, they have been, there are trump-up charges filed against them. So they are just there, no, but have a hard time in organizing. Maybe that's all for now. And many thanks and solidarity to all our friends in Indonesia and Malaysia.
Terima kasih, G. Estrada.
Thank you, G. Estrada from UMA.
Nasional dan saya kira
So,
apakah suara saya terdengar ya?
can you hear my voice?
Oke, saya kira apa yang terjadi
Yes.
Okay.
situasi yang terjadi di Filipina.
So what happens in the Philippines, I think it's quite similar to what happens in Indonesia. About the COVID handling, the health facilities. And what's important for me is that when Philippines always impose lockdowns, and you said that they have a militaristic approach, and it all, of course, restrict the mobilizations of the workers as well as the trade unions. Thank you very much, G. Estrada, for the opportunity. And without further ado, I'm going to invite our colleagues from Malaysia. We have here with us colleagues from the GSML, Plantation Community Support Network. Karti, hello, Karti. Karti, yes. Oh, sorry, Karti, yes. The floor is yours.
Atau bahasa Indonesia?
Bahasa Melayu.
Will you be speaking in Malay? Okay. Can you hear me? Yes. Well, actually, briefly about what's going on in Malaysia. 1 second. Please wait. So in Malaysia, with COVID, the cases are on the rise. The Malaysia's health system has collapsed. In addition, we're facing political crisis as well. The impression on plantation workers, I mean, we can't forget about them. With migrant workers as well. For the past 2 years, during this crisis, every time there is a crisis in many places, usually people are showing the weaknesses of it shows the weaknesses of the government, but a lot of the burden falls on migrant workers, plantation workers, and this is something that we've encountered in previous years. Also, for example, the Rohingya refugees, they are burdened so that the government can cover their shortcomings. The conditions in Malaysia has worsened in the past 2 months. Since in Sabah, the cases increased in Sabah. There are challenges with the movement of the people. Because of the travel restrictions, it's been very difficult for me to travel to the south part of the country. But in the north, it seems that the cases for plantation workers, well, there are impacts. The impacts are there, but not as major compared to other workers in other sectors, because the plantation sector is not closed. The sector is still allowed to operate last year and the previous year. Wages and if they they're not, so I've traveled to the northern part of peninsular Malaysia. They still get paid, and the center part of peninsular Malaysia is impacted the worst. There are not that many plantation workers in this area: Selangor, Kuala Lumpur, and the central part of peninsular Malaysia. Not as many as those working in the northern or southern part of Malaysia. However, there are Malaysian workers and migrant workers there. In some parts of the countries, they are facing the challenges of travel restrictions, social restrictions, and in plantation workers, they cannot leave the plantation. They can only obtain their staple foods. They can only buy their staple foods, get their needs in the plantation. And in the past several years, the Malaysian government only informed that there are about 200 COVID cases, the official numbers, from the plantation sector, from migrant workers. That is the official ministerial report. In their reports, I don't believe them. However, the figures that I got from several days ago is about 290,000 cases since the beginning of COVID. These are the cases for non-citizens. That's a portion of the entire 1.2 million cases. So there are cases of non-citizens. The majority are workers, migrant workers who got COVID. That's a major issue here. This contradicts the statements issued by the ministry, by the government. Moreover, during COVID, Malaysia has a law. We have our law in Malaysia. In Malaysia, JSML is fighting to get housing for the plantation workers. Since the fall of the previous government cabinet, that scheme has not been further discussed. During COVID, in several of our advocacy work, we ask workers not to leave their housing areas. The government regulation says that workers older than 60 years, they have to leave their company housing. But we tell the people, do not leave your homes, even if you get notice from the companies. So in some areas, for example, in Perak area, there are plantations that they cut off the water and electricity to the workers' housing. These are for workers in the plantations, because these are the company housings. But if therefore, people who no longer work for the company have to leave. And we tell the workers, even if you're no longer working for the company, even if you're over 60 years of age, stay and we will fight the company. So we protested, and the water and power were installed in these housing areas, and we're bringing our case to court. So the the company is taking advantage of this law to to evict the workers from their housing. So we're conducting a campaign, and we'll be pushing for this case. And the main point of this campaign is that we don't want the workers who are above 60 years old not to leave their homes, because we're saying that because this is COVID, we have to provide housing for these people. And this is something that we share with everyone. Our demands are: do not evict the workers and do not terminate workers. In Malaysian plantations, they are short of workers. Employers are saying that they are short of workers. The government is being strict of not bringing in migrant workers. They're very strict about that. There are some workers coming in. These are non-formal, non-procedural, undocumented workers. And this will indirectly cause to the increase of undocumented workers. And therefore, this will make these workers even more vulnerable. They're going to be more vulnerable, and it's going to be even more difficult for them to get their rights being undocumented. In JSML, some of the issues that we are raising right now is the system, the Malaysian health system. The Malaysian health system has collapsed. I've seen two parties saying that our health system is already vulnerable, and because of COVID, this is inevitable. And the most vulnerable here, because of the collapse of the health system, is the migrant workers, our migrant workers. If Malaysians cannot even access health services, what about migrant workers? They're going to be even more vulnerable. And we are disseminating information. If you need anything, if you need assistance, information, please let us know. These are some of the things that we are working on in our areas where we work in our organization. These are some of the things. So I think that's the current condition in Malaysia. Thank you very much. Thank you very much, Kartiges. Thank you. I would like to note some of the important points that you have shared. The first is about the collapsed health system in Malaysia, specifically with the increase of COVID cases in Malaysia. And the momentum happening in Malaysia is similar to Indonesia. Kartiges, you are based in northern Malaysia, and you receive information that only about 200 cases of plantation workers, migrant workers who are infected with COVID, but the numbers is not trusted. And the majority of migrant workers who are infected is in the central part of Malaysia. And then there is a situation that has led to the termination of workers, especially those older than 60. And companies are trying to get these older former workers to be evicted from the housing areas. Thank you very much, Kartiges. Thank you very much. And now our last speaker, we will go back to Indonesia. I would like to we're going to hear from Rudy from GSBI, from the Indonesia Labor Union Association. Rudy, are you with us?
Yes, yes, I'm here.
Saya kira kita juga ingin mendengarkan
All right, Rudy, we would like to hear from you
nasional
regarding national policies on COVID-19 in Indonesia.
apa sebenarnya dampak-dampak
What
kebijakan itu terhadap pekerja
are the impact of these policies to workers?
apa yang seharusnya
And
dilakukan
in your opinion, what is it that governments and companies must do uh,
Oke, Bung.
in face of these uncertain situations?
Saya waktu dan
The floor is yours, Rudy.
halo.
Rudy, are you there?
Ya.
Terima kasih.
Okay, thank you very much. Thank you very much.
Halo, apa dengar?
Can you hear me? Hello?
Dengar, Bung. Dengar.
Oke. Terima kasih moderator.
Thank you very much, moderator. Thank you. Greetings. Good afternoon. May peace be upon us.
Perkenalkan, saya Rudi Habedaman.
My name is Rudy Daman from the Indonesia Labor Union Association. Our members are unions from various industrial sectors, including palm oil plantations, which we are discussing right now. GSBI is part of the TPOLs. Upon listening to the previous speakers, it's very clear about the condition of palm oil workers during COVID, whether those working in Indonesia or as migrant workers in Malaysia. The COVID-19 pandemic clearly shows that there is a vulnerability and isolation faced by workers and their families. The reduced wages, but increased work, the work increased, and then there's increasing difficulties in getting staple foods. There's worsening health services. They are not getting, there's restriction for spaces for democracy, for of their freedom of association. And we've heard from West Kalimantan from a company owned by Wilmar Group. Workers are demanding for minimum wage for 2021, and this has caused two of our heads of unions to be terminated because they protested to get minimum wage, and others were reported to the police. However, the support and solidarity from the network, from various networks, including TPOLs, our colleagues were finally released, or the colleagues who were reported to the police report was revoked. The government policy under President Joko Widodo to handle COVID-19, the orientation of these regulations is not to protect the community, the public, especially palm oil workers. We know that palm oil sector in Indonesia are not just impacted, it has received profit during COVID. The agriculture industry, including palm oil, is one of the industrial sectors that has been doing pretty stable this year. Similarly, during previous crises, such as the 1998 crisis. However, this situation is very different, and it shows a stark irony with the condition of palm oil workers and their families. The COVID-19 Management Relief Acceleration Program and the Economic Revitalization Program or Economic Restoration, the situation has been has been leveraged by the elite to improve their condition. The economic restoration policy, the budget has increased to more than 700 trillion rupiah in 2021. The increased budget is not allocated to save workers. And the vaccine provided is developed. The vaccines are provided to save these elites, to make sure that companies, palm oil companies, can continue to operate. This means this increased vaccination means increased profits for these vaccine industries and imperialist actors, including the US. They're not providing vaccines for the workers when they have to face increased production during COVID. So if you look further into this, Indonesia does not have sovereignty for health. All medicines, vaccines, health equipments, they rely on imperialist countries. Therefore, COVID is an instrument for them to maintain their dominance over other countries, especially the US and their allies. This includes China as a growing imperialist power. They're trying to get political and economic dominance. This is what's happening. This has led to the health crisis in Indonesia. Therefore, I believe that we need serious ways to handle this, serious commitment from the Indonesian government. So, in my opinion, the large-scale social restriction, the multi-tiered public activity restrictions, these are not adequate to correct the incapability of the current government. The public is facing challenges in getting food, education. They're losing their wage and income. Some can't even get income. The government is using COVID to pass laws that will facilitate the elites, the bourgeoisies, and to be able to export their capital. And this will continue Indonesia to be left behind, to be still to be stuck in its debt. As we know, in the time when the government is supposed to be focusing on managing the pandemic, the Omnibus Law, Job Creation Law, was passed as one of the Joko Widodo's regime as one way for the current regime to strengthen imperialistic elites in Indonesia. This shows consistently with the previous economic packages that the government has passed. The main objective there is deregulation and other ways to facilitate loans. Similarly, with employment under the Manpower Ministry, there are no regulations that protect workers. For example, we have regulation from the Ministry of Manpower of 2020 regarding the components of living requirements. There are additional components for these needs from 60 to 64, but these remove some of the needs for women, such as women workers. These are some of the measures from the government, from the president. This includes the issuance of government regulation to ensure that there is no significant pay raise during COVID. These are done to ensure the sustainability of businesses. We have what's called to save the wages for labor-intensive sector. For labor-intensive sector industries such as food, beverage, cigarette, textile, leather and leather goods, footwear, toys, and furnitures. These involve a lot of workers. These companies, these employers are now allowed to pay less than the minimum wage. This is one of the ways for the government, the current cabinet, to allow the stealing of these workers' wages. And there is a regulation for 2020 and 2021 allowing employers to pay holiday bonus to workers in installments, or only to pay part of these mandatory bonuses, or the bonuses are paid in 3 or 4 installments for 2020. So the holiday bonus for workers, some of the workers haven't fully received their bonus because of this government regulation. Also, we have implementing regulations from the omnibus law, and these affect workers. And these laws, these demands that we need to make is a special regulation on the protection of palm oil workers. To this day, palm oil workers are not included by existing regulations. This requires our joint attention. The government must think about the protection of workers, the protection of workers' rights. This includes forcing companies to implement safety protocols, providing PPEs, not deducting wages. The government and businesses must provide also self-isolation facilities monitored by health facilities, including providing accessible, adequate food for plantation workers. The government has to ensure quality vaccination programs, and this has to be able to reach workers. We have to make sure, we have to refuse paid vaccinations. The government has to monitor and give penalties to companies, and the government has to have stricter monitoring of the companies. That is all from me. Thank you very much. Thank you very much, Rudy. There are several points. Well, there are a lot of points, but I'm going to try to summarize. But I know all of these are well noted. First of all, this current COVID-19 pandemic, the government and businesses are taking advantage of the COVID pandemic to make money, and also by the vaccine industry and industries such as palm oil, they are still making profits. In addition, the government is also taking advantage of COVID and businesses to pass a number of regulations. And we know, apologies, we lost the speaker. Apologies, we lost the moderators. And so during the COVID pandemic, employers should be reducing the workload, but maximizing the wages of workers. Rudy also emphasized for the newest regulation for health, workers' rights to work, and right to health services. Thank you very much, Rudy, for your time and place.
Masuk ke sesi selanjutnya, yaitu sesi tanya
We will
jawab.
head to
Now we are going to go to the next sessions for the questions and answer session. any one of you who would like to ask some questions, whether it be from the reporters or other participants, you are allowed to do so. I'm going to limit for 3 first questions.
Ada yang ingin bertanya?
Is there any questions from the floor?
Informasinya. Halo.
Hello?
Nggak ada ya kayaknya.
Oh, it seems that we don't have any questions.
Halo. Adakah dari teman-teman jurnalis, wartawan?
Do we have questions from the journalists or other participant? Mr. Moderator, there's question from Oliver in the English for Miss Emmy.
Saya mungkin bantu bacakan dalam bahasa.
Okay, I'm going to
Pertanyaannya adalah
read the questions.
jumlah pekerja yang asal NTT yang meninggal sejak pandemi ini.
So the number of workers passed away from the East Nusa Tenggara since the pandemic began, is it increased? And what is the cause of the passing away? Is it because of COVID or other causes? Okay, so from our note, in 2020, there are 74 cases. And in the note is non-COVID. So they can return home to Kupang. In 2021, it's increased. So during the pandemic, it's increased. It's 81 people on June. In the past times, in June, usually it's 12 or several tens of cases, but this year it's increased, but there's no note whether it's COVID or non-COVID. But what we do know that most of the cause of death is due to comorbid. So we do apply strict health protocol. So we wrap the bodies. The cause of death is respiratory problems, heart problems, brain disease. So based on that, I can conclude that the cause of death is comorbid, and I'm not really sure whether it's COVID or non-COVID because we cannot open the body. So yeah, basically, yes, the number is increased. In June, it's 81 people this year. So usually in the past years, in June, it's maybe like 20 or tons of case, but now it's increased. And yeah, again, the cause of that is mostly comorbid because the heart problem, respiratory problem. But I cannot say for certain what is the cause of that because we cannot access the health informations, especially for the oil palm workers. They're very lack in health service. Thank you, Ibu Emi. Do we have any other questions? If not, then I'm going to give opportunity to Cornelis to say something because he says that he has some new added information from the ground. Thank you, moderator. dear colleagues, I want to add one more important information. Yesterday night, we have been contacted by one of the oil palm company in Mahakam, which is 14 hours away from Samarinda. The workers passed away in the clinic, but the officer in the clinic did not issue a death certificate. And when the bodies is sent to the local regional, the local hospitals, and then they conducted tests, and the result is positive COVID-19. So the family just accept that result because it's positive COVID-19. It means that the bodies cannot be buried in the hometown. But there's some doubt actually, because we're not sure if the test is valid if it's taken 18 hours after the time of death. So that's what's happened in the case from Kisol in Manggarai district.
Atas informasinya.
Thank you, Mr. Cornelis, for the information.
Bung Firman.
Next, we have Firman.
Oke. Terdengar nggak suaranya?
Can you hear me?
Oke, terima kasih Bung Uloh atas tambahan.
Thank you, Mr. Moderator.
Terkait dengan kondisi di lapangan di wilayah Kalimantan.
So yeah, I'm going to add some more information from the ground. So since in the beginning of pandemic, our team members sent letters to the management, request for better health service and health facilities, and to give vitamins and also to provide tests to the workers in the plantation.
Tidak berlangsung lama pemberian fasilitas kesehatan penunjang seperti pemberian masker, kemudian pemberian vitamin hanya berlangsung sekitar 2 bulan.
But then the company only provide the mask and vitamins only for like 2 months. And there's no other program. As for the vaccinations, some companies do provide vaccination programs. Some works with the local government and some do independent programs. So they provide doctors and they provide the vaccinations for the workers. For those who works with the local government, the vaccinations roll out in the police office. And the workers who join the vaccination program, they still receive the meal allowance. For some colleagues in bases,
90% hasilnya reaktif. Akhirnya
so I received reports that there's actually a plan for our colleagues from bases to go to the district, but because after they being tested, almost 90% is reactive, so they cannot go to the district. And what I receive also in some companies pay for the remuneration while the workers is in self-isolations.
And for the vaccination program for the staff and assistants, the company facilitate this program. They facilitate the transportation for them to go to the district to receive the shots. But for the workers, workers levels, they receive the vaccinations in the village halls, and they did not receive any facilitation such as transportations or the meal allowance. For the newest case in one factories, we receive information that there are 5 workers positive COVID, but the factory itself is still in operation. And the company did not support these workers in self-isolations with food or vitamins. So yeah, so that's my additional information. Thank you very much, Mr. Moderator.
Terima kasih Bung Firman. Ini ada
Thank you, Firman.
Paman Akib.
We also have Akib here raising hands.
Sebenarnya saya bingung
Thank you.
menuju dan kepada siapa.
So
Tentang kondisi buruh dan tentang kondisi
yeah, well, I actually don't know who these questions should refer to. Can you introduce yourself? Oh, yeah, sorry. My name is Akib in South Sumatra. I want to also tell stories about what happens in the workers in my area. Because in my area, there's also a lot of plantations similar to in Kalimantan. I actually have questions, but I don't know who can answer this. I'm also a student in Yogyakarta. I'm taking a literature study. A few months back, there were protests regarding land issues in some companies. But as a student, as a young people, I don't know what I can help, what I can do to help these workers. As a literature student, I have this inspiration. Maybe I can tell their stories in form of a book, and their stories can be recorded in history that way.
Hal inilah yang membuat saya bingung untuk melakukan pendekatan-pendekatannya terhadap kelas buruh yang ada di tanah.
But I don't know how to approach the workers. I mean, the local government here and the journalists here, they rarely tell stories about the workers here. And I don't think local government talk about this issue much. Very rarely. But we know that the plantation area here is not only thousands of hectares, but tens of thousands of hectares. And it covers also my hometown. So yeah, thank you. That's my questions. Okay, so maybe if I can summarize, maybe you your question is how the colleagues in Muara Rumpin respond to the land conflict issue there. Okay.
Ada lagi yang ingin berbicara, bertanya, maaf.
Do we have another questions? So I'm going to take another questions from the floor.
Kalau tidak, mungkin dari kawan-kawan serikat
Okay, if not, maybe from the speakers or from colleagues from the networks and from the trade union can respond to Akik questions. Hello. Yeah, Mr. Cornelis. Yeah, I think this question is interesting. So there are two things. The first is the issue of the workers, and the second issue of land conflict and the community. If I may propose, if you're targeting the company, the workers in the company needs to sit together and build a joint strategy and build cooperations and try to map the case. And peoples, maybe you can also help with the information on the global supply chains of the company or the plantations. You can trace whether the plantation has certifications or not, whether it's ISPO or RSPO, where they sell the products. That's what we usually do in TPOLs. We usually try to solve the case from that point. And it would be better if the workers from the company also involve with the networks and ask for assistance from people so we can also help. Thank you, Mr. Cornelis. Oh, can I respond to that response? Okay, just 2 minutes, okay? Yeah, because in the past few days, in the past few weeks, I go to the PT Deni market because there are some community who work there. The remuneration that they receive from the company is quite high if you compare with other companies. So they do provide good remunerations. So that's why when there's a land conflict happens, only the traditional community or the indigenous community respond to that issue because the workers doesn't involve in that conflict. Okay, thank you, Aki, for the response. Thank you. And I'm very sorry because we are running out of time. I would like to thank all the participants joining this press conference. And for the press conference itself, you can access that through the link in the chat room that's sent by Rizal. And for the last session, I'm going to read out the press release. So Rizal is the one who's going to read out the press release. And Rizal, I'm going to give the floor to you. You can read out the press release. Thank you, Mr. Ulo. And thank you to the participant here. It's not something that we are wanting to hear about the bad conditions of workers in palm oil plantations. We do this because we want the public to know that pandemic COVID-19 reach out also to the remote areas in plantations, but we did not hear about that much because they are isolated from the outer world, because they are far away from the infrastructures and they are in the remote areas. But actually, they also workers, laborers, and they have similar conditions with the, like workers in the factories here in the big cities. We have suspicion that the numbers of workers infected by COVID-19 did not reflect the actual numbers or the actual conditions. And we have suspicion that there are a second wave because the report that we read that it seems that the outreach of COVID-19 have come to the outer of Java. And it's not only about the transmission of the disease itself, but there's also issues about the access to health facilities and the access to food supplies, and it affecting the life of the plantation workers and their families. We also hear the stories about how the workers have to buy from the shops set up by the companies with a higher price. And it increased their debt, and they need to repay that by working even harder. And we know that the health facility outside of Java Island is very much, you can say they're not as good as the facilities in Java Island. With the increasing risk in the plantations area, we hear reports that the plantation sectors is actually did not significantly impacted by the COVID-19 from the business point of view. The oil palm industry keep exporting the products, and they could even record a surplus in their balance. But that is to the cost of higher work hours of the workers. And you can read out the reports. This oil palm business, they record a surplus from the palm oil product. It has a record of $10.6 million US dollars. It's increased from the past years. And this year, the volume of export of the palm oil, the crude oil and its other product, it's actually increased. It means that the oil palm industry keep getting profit. But in other side, we hear that the transmissions of COVID-19 among the workers is increased, and we also hear about the poor working conditions and it affecting the workers as well as their families. And we want the government in Indonesia, Malaysia, Philippines to really focus in handling the COVID-19 and to really prioritizing the community, the workers. And we urge them to really have a targeted programs to increase the condition of the workers. And we want to also have a better condition for the migrant workers, for have an easier testing, because as we heard that even for to get the test, they need to travel far away, and they have to have like several documents. And we also demand the companies the transnational companies to respect the life of the workers in their plantations, regardless of the status of the workers, whether it's casual workers, local workers, or migrant, documented, undocumented. So we want them to respect the life of the workers. It should be the main priority. I would like to thank all the participants here to joining us, the journalists, speakers, participants. Thank you to the moderator, and also for our colleagues here who still doing advocacy work, facilitating the workers. It's really sad that we are losing lives because of poor health facilities, and we want these stories to be heard by the public and to receive the attentions from the government and the public. Again, I would like to thank all the speakers here and the participants. Wish you all health, and I hope that we can keep our solidarity and we can help each other, especially during this hard time. Thank you again very much for your time. Have a good afternoon.
Terima kasih semuanya.
Terima kasih Bung
Thank you
Rija.
too.
Terima kasih
Bye-bye. Terima kasih.
Bu Maria.
Selamat.
Ya, terima kasih.
Terima kasih kawan-kawan.
Terima kasih Bu Emily.